Dupuytren's contracture, also known as Dupuytren's disease, is a common condition that affects the hand, particularly the fingers. It is characterized by gradual thickening and tightening of the tissue under the skin of the palm. This thickening can start to pull one or more fingers into a bent position. In this video, I'll be discussing what Dupuytren's disease is, what are its symptoms, and what treatments are available to help with this condition. I am Ravi Mallina, consultant hand and wrist surgeon at Shirley Oaks Hospital in Croydon, and I have been treating patients with Dupuytren's contracture for over 8 years. So I can answer these commonly asked questions about this disease. So, what is Dupuytren's contracture? Dupuytren's contracture usually starts as a small lump or a nodule in the palm of the hand, typically near the base of the ring or the little finger. Over time, this lump may develop into a thick cord pulling one or more fingers into a bent position. This bending or contracture can make it difficult to straighten the fingers fully, impacting hand function and everyday activities. Who is affected? Dupuytren's contracture is more common in men than in women, and it usually appears after the age of 40. There are several factors that may increase the likelihood of developing Dupuytren's contracture, including a family history of the condition, smoking, excessive alcohol consumption, and diabetes. Interestingly, it is more prevalent among people of Northern European descent, earning it the nickname the Vikings' disease. What are the symptoms of Dupuytren's contracture? The symptoms of Dupuytren's contracture typically progress slowly over a period of months or even years. The first sign is often the development of a small hard nodule on the palm, which might feel sensitive or tender. As the condition progresses, more nodules may appear, and then these can develop into tough fibrous cords that cause the fingers to bend towards the palm. The most commonly affected fingers are the ring and the little finger. In severe cases, the contracture can limit the ability to perform daily tasks such as grasping objects, shaking hands, or even placing the hand flat on the table. How is Dupuytren's disease diagnosed? Diagnosis of Dupuytren's contracture is typically straightforward and is based on physical examination of the hands. I would look for nodules and cords in the palm and assess the degree of contracture by seeing how much the fingers can be straightened. In some cases, imaging tests such as ultrasound or MRI may be used to get a clear picture of the affected tissues, but these are not usually necessary. Treatment options. Treatment for Dupuytren's contracture depends on the severity of the condition and the level of discomfort or functional limitation experienced by the patient. In mild cases, where the contracture is not causing significant problems, no treatment may be necessary. Monitoring the condition and managing any discomfort can be sufficient. However, when the contracture begins to interfere with hand function, there are several treatment options to consider that I will discuss in turn. Needle aponeurotomy is a minimally invasive procedure where a needle is used to break the cord of the tissue causing the contracture. It's done under local anesthesia and has a short recovery time. The use of collagenase enzyme injections is a newer, non-surgical treatment that is currently not offered in the UK, but is available in Europe and the US. In more advanced cases, a surgical procedure called fasciectomy may be recommended. This involves removing the affected tissues to release the contracture. Surgery is generally more effective for severe cases and requires a 2 to 4 week recovery period and specialist hand therapy. Although less common, radiotherapy may be used in early stages to slow the progression of the disease by applying targeted radiation to the affected tissue. Living with Dupuytren's contracture. Living with Dupuytren's contracture can be challenging, especially if it progresses to a stage where it affects daily activities. I advise my patients to monitor their condition regularly and seek medical advice if they notice worsening symptoms. Engaging in hand exercises and keeping the hands flexible may help, although there is no strong evidence that specific exercises can prevent progression. Overall, a Dupuytren's contracture is a manageable condition with several effective treatment options available. If you or a loved one are experiencing symptoms, I encourage you to consult with a hand specialist to explore the best course of action. Early intervention can help preserve hand function and improve quality of life. So that's a brief guide to Dupuytren's contracture and how to treat this condition. If you have any more questions, feel free to leave them in the comment section below. If you would like to arrange a consultation with me or another consultant in your local area, you can call us or book an appointment at circlehealthgroup.co.uk.